Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and welcome to our press briefing for Thursday, June the 11th, as we come toward the end of the 14th week here in Montgomery County that we have been living within this COVID-19 pandemic. So since our briefing this past Monday, we've had a total of 169 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 7,682. These positive cases are a result of a positive test for the virus, not from the antibody test. On Tuesday, we reported 73 cases. There were a number of those cases that were over 30 days old. They were just some backlog of cases that came in. On Wednesday, we had 51 cases. Today, we have 45. Over the course of these 3 days, 30 cases were from long-term care facilities, and 5 were from our Montgomery County Correctional Facility, 4 involving inmates and 1 involving staff. 134 were from the community. These positive individuals are from 38 municipalities. 61 of 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 6 years old to 98 years old. And as always, you can check out our county map found at moncopa.org/COVID-19 for updated geographic information. We have 92 females and 77 males. We know that 3 were hospitalized. We know that 4 were at home in isolation, and we do not have information on the rest. I'm also saddened to confirm that 40 more Montgomery County residents have lost their lives to COVID-19, which brings us to 765 deaths confirmed positive from COVID-19. Now, 37 of these deaths were reported Tuesday and Wednesday, and the date range for these 3 days of deaths is from April the 21st to June the 10th. We know that 16 of these individuals died in a hospital, 21 in a long-term care facility, and 3 in a private residence. They ranged in age from 46 years old to 97 years old. And in total, we now have 405 females and 360 males overall that have lost their lives to COVID-19. We do try to obtain self-reported racial identification and among those individuals that are deceased. And we have 18 Asian, 3 Asian Indian, 3 Asian Korean, 93 African American or Black, 282 white, and 366 unknown. In terms of probable deaths, and these are defined as COVID-19 being listed on the death certificate as a cause of death, but not confirmed by a lab test, we have 92 probable deaths. So adding that to our 765 confirmed positives, that gives us a potential total of 857 deaths. Now, if we do get laboratory confirmation on a probable case, then we do move that to the confirmed positive count. In terms of long-term care facility deaths, we have 641 confirmed positive of the 765 total confirmed positive. So the long-term care facility deaths represent 84% of our total deaths. I do want to give you an update that is now available on our COVID-19 website. we have a new feature on our municipal map. So what we're showing you here now is a screenshot of that map, and it will default to showing the total number of positive cases over the last 14 days for the entire county. But in the upper right-hand corner where it says municipality, there is a pull-down list of all of the municipalities. Once selected, you can see the case count for the past 7 or the past 14 days of the specific municipality that you have chosen. And it will also tell you how that case count compares to the prior 7 days or the prior 14 days. So here we have an example of Upper Merion. You can see that in the last 14 days, Upper Merion has had 14 positive cases, which is a decrease of 25 compared to the previous 14 days. And then down at the bottom, if you click on the last 7 days, you can see that Upper Merion's had 8 cases in the last 7 days, which is increased by 2 compared to the previous 7 days. So just giving you a sense for the type of information that's now available on our website. Moving on to hospital beds. Today, the number of hospitalized COVID-19 patients is approximately 135, which is a continued slow decrease over the last several weeks. 33 individuals require a ventilator, or approximately 24%. Just to put this into context, at our peak, we had well over 400 patients that were hospitalized. So this is very, very good progress. The situation continues to be stable at our Montgomery County Correctional Facility. As we've discussed, we did retest every inmate and every staff member at the correctional facility around May 21st and into the following week. And we did have 90 additional inmates out of 716 that tested positive, and we have had a handful of staff as well. All individuals are stable and no one has required hospitalization. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 837 today, a net decrease of 505, which represents a 38% decrease in our correctional facility population. Since March 13th, there have been a total of 1,102 discharges and a total number of commits of 485. Community testing remains widely available for anyone in this county. Any person who needs or wants to be tested for COVID-19 is welcome to visit any of our county testing sites. We no longer require that you have symptoms or that you know that you've been exposed. Anyone who would like to be tested can be tested. These sites are no cost. They do not require a healthcare provider's orders, and we will test individuals of any age. In Pottstown, our walk-up community test site is located at our Office of Public Health at 364 King Street in Pottstown. Testing there is available Monday through Friday from 11 to 1, weather permitting, and you can register for an appointment by calling 610-970-2937 starting at 8:30 in the morning of the day that you'd like to be tested. The Norristown Walk-Up Community Testing Site is located at the Delaware Valley Community Health Center at 1401 DeKalb Street in Norristown. And testing is available there Monday through Friday, 11 to 1, weather permitting. To register for an appointment in Norristown, you can call 610-592-0680 starting at 8:30 a.m. the morning that you'd like to be tested. In both Pottstown and Norristown, there are Spanish-speaking operators available. At our Montgomery County Community College testing site, they continue to remain open and doing well. For the dates inclusive of April the 16th to June the 6th, we've now tested 8,906 individuals. We've received results on 98% of them, and that is 1,198 are positive. For 43 days of testing, we are running 14% positive, but for the past 14 days of testing, we are running a positivity rate of 13.4%. So we are starting to slowly trend downward. The site will be open Monday through Friday. They will not be open Saturday or Sunday this weekend. And to make an appointment for tomorrow, Friday, you can go online at 8 a.m. at moncopa.org/COVID-19 under the green County Testing Information button, or you can call 610-631-3000. And again, the site will be closed Saturday and Sunday. As a reminder, both CVS and Rite Aid are offering no-cost testing at several different locations in Montgomery County to those who are 18 years of age and older. And you can see an updated list of these locations at moncopa.org/COVID-19 under the County Testing Information button by clicking on the testing sites map. Now I have a couple of announcements today, and I'm going to start with Dr. Al Wong, who's going to remind us all of the importance of routine health screenings and seeking health care for emergencies. Dr. Wong.
All right, thank you, Commissioner. So since June is National Safety Month, I wanted to take this opportunity to remind everybody about the importance of routine health screenings and seeking timely care for emergencies. Our emergency departments have continued to see a decline in the number of patients coming in for time-critical conditions such as stroke and heart attack, and we do see this reflected in our countywide EMS and 911 call volume data. I've also noticed this when I've been working in the emergency department clinically over the past 3 months. Preventative medicine visits are one of the best ways to keep from getting sick, whether it's from COVID-19 or another disease. For those of you with children, adhering to a regular vaccination schedule and well-visited screening examinations are critically important. For adults, especially those with chronic medical conditions such as hypertension, diabetes, or high cholesterol, staying in touch with your primary care doctor or clinician during these times is more important, now more than ever before. Many doctors' offices have enhanced infection control procedures to help keep you safe during your visit, or can address your questions and concerns via a telehealth visit. As a full-time emergency physician, my colleagues and I have spent years encouraging people to seek prompt emergency care for time-sensitive conditions like stroke and heart attack. There is clear evidence that the sooner you seek help, the better your chances for full recovery will be. If you're having a stroke, as many as 2 million neurons can die for every minute that someone delays getting treatment. And of the people who die from a heart attack, about half die within the first hour after their symptoms start. Some signs and symptoms might prompt you to consider going to an emergency department or calling 911 include shortness of breath or difficulty breathing, signs of a heart attack including chest discomfort or unusual discomfort in other areas such as the arms, back, neck, jaw, or stomach, or other possible signs such as breaking out in a cold sweat, sudden nausea, or lightheadedness. In addition, open fractures or other serious trauma, fainting or dizziness, sudden numbness or weakness, bleeding that can't be stopped, severe abdominal pain, especially if localized to one area, high fever, confusion or changes in mental status, coughing up or vomiting blood, or severe headache or head injury, especially if patients are taking blood thinners or on aspirin, or a sudden ability to see, walk, move, or speak, are all reasons that you should consider coming to the emergency department or calling 911. If you do call 911, our telecommunicators can give you simple instructions over the phone on how to help the victim. Our EMS workers are highly professional, well-trained, and equipped with the latest treatments and technologies to bring many aspects of emergency department care right to your front door. If you're having serious signs of symptoms such as chest pain or signs of a stroke, please don't wait at home to see if things get better. Call 911 right away. Our hospitals are well equipped to care for patients with or without COVID-19 and use enhanced infection control and disinfection procedures to keep everybody safe. Our staff members are ready, willing, and able to care for you if you're having an emergency. You're not imposing on us, so please don't delay in seeking care for serious conditions. And on behalf of all our public safety professionals, EMS workers, and hospital staff members, please allow me to express my sincere thanks to all of you for the individual sacrifices you've made over the past weeks to get us through this pandemic together. Thank you very much.
Thanks, Dr. Wong. Okay, second announcement. The Montgomery County Office of Mental Health and Drug and Alcohol is asking individuals who have received behavioral health services or their families during the COVID-19 pandemic to share their feedback and experiences with using telehealth services during this time. In partnership with county behavioral health offices, insurance companies, and community mental health organizations, the Pennsylvania Department of Human Services Office of Mental Health and Substance Abuse Services, the mouthful, but we call it OMSAS for short, significantly increased telehealth and telephone service delivery to increase flexibility and access care within the Medicaid behavioral health system during the COVID-19 emergency. OMSAS wants to make sure that future behavioral health services through telehealth meet ongoing community needs. Individuals and family members who received services through telehealth are invited to complete the survey by June the 22nd. There are two options for completing the survey. One is through the Montgomery County website, and you can see the directions on there. You can click departments from the menu, and then there'll be, select Health and Human Services from the department's menu, and there'll be a link to the survey on that page. Or you can complete the survey with a consumer and family satisfaction team member, and there's different contact numbers there on your screen for either children, adult telehealth services, or drug and alcohol telehealth services. So we really urge you to complete this survey if you made use of these services. We have heard from some that they actually really like the telehealth services and the flexibility that they have been able to use those services. So if this is something that you would really like to see continue or expanded, your input in this survey will be extremely helpful. Okay, so as you all know, we entered the yellow phase last Friday, June the 5th, and so now we're coming to the end of our first week in the yellow phase, and I'm happy to tell you that we're continuing to move in the right direction. Just one note of caution though, looking at the data from the Johns Hopkins University website, the Washington Post reported today that since June 1st, after reopening in different parts of the United States, at least 14 states have recorded their highest ever 7-day average of new coronavirus cases. And this is a very diverse group of states. It includes Alaska, Arizona, Arkansas, California, Florida, Kentucky, New Mexico, North Carolina, Mississippi, Oregon, South Carolina, Tennessee, Texas, and Utah. So again, I think we are in good shape here. We're moving in the right direction, but just want to remind everybody that this could easily go the other way. So why do I say we're going in the right direction? Well, we're going to give you our updated positivity graph today, which we've been showing at the end of the week, each week for the last several weeks. So just a couple reminders about this graph. The gray bars are the number of people that were tested on any given day. And today this graph goes through June the 6th. The dark red line is the 7-day average, and the kind of pinker line is the 14-day average of all of the cases in Montgomery County. And today that 7-day average is down to 43.3. That's compared to 62.1 on May the 31st. So that's comparing May the 31st to June the 6th. When we look at just cases from the community, which is that dark blue line, The 7-day average is now 36.6 as of June 6th, compared to 50.3 on May the 31st. And then if you drop down into those kind of yellow-orange lines, which are right on top of one another, those are from our long-term care facilities. And the 7-day average there is now, as of June 6th, 6.6, compared to 11.9 on May the 31st. So this is all great news. We are definitely moving in the right direction. And I just want to remind everybody, though, that there continues to be virus in our midst, and we must continue to take precautions when we are out in public. Be mindful of all the social distancing guidance that's out there, particularly when you are inside a store or some other closed space. And reminder that any one of us could have the virus and not have symptoms, but still be contagious. And so we just have to always think that it could be us. And because of that, we want to cover our coughs, cover our sneeze, keep our hands clean, and wear masks to protect those around us. If both people have on masks, then that gives us all the most protection. So for the sake of our community, just keep doing what you've been doing, keep doing the right thing, and we will get through this. And that's it for today. I'm happy to take questions.
Thanks, Commissioner. We're joined this afternoon by Carl Hessler from the Pottstown Mercury. Carl?
Thank you. Good afternoon, Commissioners. I have some election questions. How many absent ballots, how many mail-in and absentee ballots were returned in this election, and is the counting procedure complete?
Good afternoon, Carl. I'll take that. We had 126,000 mail-in votes, mail-in ballots. They have been counted. What they are counting now are the provisional ballots, which have to be counted by hand. And we have 5,000, almost 5,000 provisional ballots. And then we had 88,688 people vote in person.
When will the counting be completed of those provisional ballots?
They've been working on that, so I can't give you a precise time. Like I said, the provisional ballots need to be counted by hand, so it takes a little bit longer. So I couldn't give you an estimate on that. I know that that's what's left to be counted now.
Okay, and how long does the county have to certify this election with the state?
I don't know.
Will you give an extension on that?
Yeah, Carl, I don't know that we have actually been given an exact deadline by the Department of State. I'm just reading something here. With regard to the provisionals, I think we'll be at least deep into next week, I would expect. Working our way through those ballots by hand. It's a multi-step process with each ballot to verify the voter is in the right precinct, that they're registered, and that they did not return a mail-in or absentee ballot. So we have a team of folks working on that. I will work to get, now that we're a couple days into that, and we have an idea of how long it's likely to take, I'll work on getting an estimate for you. And once the count is complete, and once tabulation, I should say, is complete, which we couldn't start those provisionals until tabulation was underway. Once that is finished, the count waits for 5 days for any challenges or that may come in, and then the election will be certified immediately following that. So we're getting closer. We'll try to get some better estimates on timing for you shortly.
Like the final counting won't end before next week.
That's right. Yeah,
Okay.
once the provisionals are reviewed and those that can be accepted are accepted, they'll be added to the final count on the website that you see that's up there today.
Okay. Given the problems with getting poll workers during this primary election because of the pandemic, will county election officials be reaching out sooner to try to get poll workers lined up for the November election in time so that all polling places can be open for the November election?
We're reaching out now. If anyone wants to be a poll worker in November, they can let us know now. We did not wait to reach out to people. We had a lot of people who did not want to be poll workers because of the pandemic. This was always a temporary poll consolidation plan. We've been very clear on that, and we would like to be back to our full number of polling locations in November. So we're not waiting. If someone is interested in being a poll worker in November, they can contact voter services and they can let us know now.
Okay. People that sought a mail-in ballot for the primary election, will they have to seek another mail-in ballot for the November election, or will they automatically be sent a mail-in ballot for that November election?
I believe they'll be automatically sent a mail-in ballot for the November election, but Lee, is that?
Yeah, Carl, let me confirm that one for you too. I'm not sure if people needed to opt in to being on the permanent list or not as a result of Act 77. I know that was I believe that was an option to opt in to being on the permanent list, not an automatic, but let me confirm that.
Okay. And is Dr. Wong still on the line?
Yes, I'm here.
Hi, Dr. Wong. One question for you. You talked about you're seeing less numbers of people coming into the emergency room for suffering from strokes and heart attacks. Do you have any statistics to compare that to last year, for instance, for a particular time period, to kind of compare that to the number of people who have been coming in during this pandemic?
We do have the information from our hospitals in our region, but we don't have exact numbers. But they have all noted a decline in the numbers of patients that have come through this year versus the same time last year. And we do know that conditions like stroke and heart attack happen at the same frequency, if not more, with COVID-19. And as a result, we are very concerned about people who are ignoring symptoms and staying at home.
Okay. Okay, thank you. That's all I have today.
Thanks, Carl. Next, we'll turn it over to Teresa Harris, who has some questions from reporters who weren't able to join us this afternoon.
There's a question from Justin Hines of The Patch, and he's asking, the Pennsylvania Department of Health's dashboard shows that Montgomery County is meeting all the state metrics to move to the green phase. And when do you estimate that Montgomery County will be ready to move to the green phase? And what do you think needs to happen in order to get there?
I think there's one metric that we don't meet in order to move to the green phase. And so if people want to take a look at this for themselves, you can Google Pennsylvania County Dashboard, and then the link will come up. Just put that into your search engine, Pennsylvania County Dashboard. And this page has information on the color status of each county, and you can compare other counties. You can see how our region looks. And there's a set of metrics that are on that page. So one is the trend of cases in the past 2 weeks compared with the previous 2 weeks has to be down. And I do believe we meet that metric. We are monitoring all of our new cases, or we're just about, I think maybe as of the end of this week, we're there in terms of doing contact tracing on all of our new cases and being able to monitor those new cases, direct contacts. So we are in great shape there. Our hospital bed use is 90% or lower per district population. I do think we meet that. The one thing where we're not quite there yet is that the positivity of the PCR, which is the test for the virus, is less than 10% in the past 14 days. And as I mentioned earlier, for the past 14 days, we're running at 13.4%. So we're really close. I suspect that they will be looking for that positivity rate to get down to 10% or maybe just under in order for us to move to green. But if we, keep on at our current rate, I would hope that we'll be in green by early July. So we're getting so close. So if people can just hang in there and keep doing what they're doing. But I do just want to remind everybody that green does not mean go back to normal. Green means, a little more flexibility, larger gatherings, some indoor restaurant ability to eat indoors, but at a lowered capacity, and a number of other things like being able to get your hair cut, which would be really nice. But it's not going to be totally normal. But I think we are all very much looking forward to green, and I think we're getting very close.
Thank you. There's no more questions.
Okay, well, with that then, we'll say goodbye, and we will plan to see you Monday at 3 o'clock. Have a great afternoon. Thank you, Megan.